How are you today?
I'm good. How are you?
All right, I am Dr. Cuffy. Nice to meet you.
Nice to meet you, too.
And what's your name?
My name is Jayla Agnew.
All right, Jayla, can you come and sit down for me today?
Yes, I can.
All right, thank you. So, today we have Jayla Agnew, a 20-year-old female who is a majorette dancer at an HBCU college. Can I ask what brought you in today?
I believe I may have arthritis.
All right, and looking at what you stated in your health history, you have bronchitis, you have allergies, Raynaud's syndrome, and scoliosis. Can I know when this bronchitis started?
When I was a little girl, but it later grew into asthma, so now I have severe asthma.
Okay, thank you. And what are those allergies specifically? Any medications?
I'm allergic to a lot of things, but I'm main to is fish and peanuts, and I have medication for it, but I only take it if I'm having a reaction.
Okay. All right, and you said what brought you in today was you feel like you have arthritis.
Yes, ma'am.
All right, and when did this pain start exactly?
When I was 15, I was a freshman in high school.
All right, and were you doing any extracurricular activity that you thought could lead to that?
I was a cheerleader.
All right, and when did you start cheer, if you don't mind me asking?
I started in kindergarten. I cheered all the way up until I graduated high school.
Okay, all right, makes sense. Where's this pain located exactly?
In my lower legs, it's like a tightness, and it's tingly sometimes, and it makes it feel like my bones are real weak.
Okay, and when do these flare-ups happen? Is there a specific time, or are they just random?
Just random times.
All right, and does anybody in your family have arthritis? Like, it's genetics, or do you think it's just you?
Not that I know of. I believe it's just me.
All right. So I'm going to tell you a little bit about what I know about Raynaud's disease and also the secondary Raynaud's disease that could lead to arthritis, which would be rheumatoid arthritis.
Okay.
All right. So here I have some notes just in case I'm a little too fast for you, a little speedy on the dot.
Okay.
All right. So Raynaud's disease is a condition in the area of the body that feels numb and cool, smaller arteries that supply blood into the skin. It is a fault in the immune system that causes the body to attack its own tissue and joints. It causes inflammation in the blood vessels, affecting blood flow in part of the body. So, with that being said, I'm going to state some of the symptoms, and we're going to see if you can relate to any of these, if that's okay. All right, so we have the pain, which is regular pain, swelling, warmth, tenderness of joints, stiffness, inflammation in joints and the bones. Do you feel like you relate to any of those symptoms?
The pain, the tenderness of joints, and the stiffness.
All right. And you said that's in your legs, correct?
Mm-hmm. Sometimes like the tenderness is like in my ankle area.
Okay.
And the stiffness is more of like this area of my lower leg, and it's like a sharp pain, and then I don't know.
And do you more so feel this in your muscles, in your joints, or your bones?
My bones.
Okay, bones exactly. All right. So I'm going to tell you some of the causes of this. So some of the causes of rheumatoid arthritis is fractures or dislocations, overuse or loose ligaments, joint infections, or poorly aligned joints. So with what you've told me so far, I believe since you have been cheering since kindergarten all the way up until high school, and you started majorette in college, correct? Mm-hmm. With all of that dance history, I'm sure it's been a little bit of overuse of the bones, correct? All right. So I feel like that is one of the main causes of what you're telling me right now. Not trying to say you have arthritis. You're still young. It's just 20. But it could be. So we're going to do more research and go more into it. But for right now, since I have told you the causes, I'm going to tell you preventions until we can find further details on your symptoms.
Okay.
All right. So for one, you can start to stay warm, keep cool. It's cold outside, girl. Grab you a coat, bundle up, lay it in the bed, chill. Don't be outside. You know it's cold. Use some hand warmers. Use mittens, gloves, scarves, hats, all of that good stuff. Make sure you keep the boots on, too. Keep them ankles covered up. You said they be hurting. And since you are in college, I know you like to have a little fun, smoke and drink with your friends. No more. And I know it's kind of sad. I know it's kind of disappointing, but you can't do it anymore. It is a big risk with all of the symptoms that you're telling me, and also with the asthma, you do not need to be smoking. And I understand that you are in college. I'm going to say that once again. But you need to keep your stress to low levels, little to no stress. It will help you in the long run. Try to get your work done early so you can chill for the rest of the week. Go to your practices. Don't go too hard because you know it's going to cause pain later. But still give it your all. There's also anti-hypertensive medications. It'll only be 1 pill a day, 100 to 200 milligrams. To prevent everything. And also calcium, 100 milligrams, 1 pill a day. And all of these will help you. So, have a great day.
Thank you, you too.